declaration today, how many of our field hospitals were activated, and actually how few beds are being used in our field hospitals. So really we have shown that we're able to manage COVID-19. So we need to now move it into the normalization of our everyday lives. I think also in this presentation you will once again see that specifically the death rate, if you look at previous waves, and you'll see Dr. Cloete will talk about it, that the death rate has remained low, the daily death rate, also our hospitalization numbers. And what you will also see is the data coming through now of the efficacy of vaccines. So you will definitely see clear data on how this fourth wave has affected vaccinated versus unvaccinated citizens in our province. And that is very, very clear to see how that data is coming out. So it's not just looking at the data in the Northern Hemisphere or in other countries. This is the data of vaccinations and past infections, and how that has built up our ability to deal with this fourth wave as citizens of this province. And so now calling for the end of this disaster declaration is key. We do not need to sort of engage with it. We don't need to actually have it put back in. It has to be renewed regularly. Let's end the renewal of it. And now let's focus, I think, this year on dealing with pandemic number 2. And that is dealing with poverty and the unemployment rates that we have in our region. And we need to really be focusing now on that pandemic. But that will come out now over the next couple of weeks. With the plans for what we will be doing this year. And I think those two need to go together very well. Ending of the disaster declaration and real good focus on pandemic number 2. But with that, I'm sure you will be very interested in the data coming out today. So let's get on with it. And with that, back to you, Kayla. Thank you.
Thank you very much, Premier. We'll now hand over to the Minister of Health in the Western Cape, Dr. Nomafrench and Mbombo.
Thank you, Kayla. Thank you, Premier. Happy New Year to everyone. Just to piggyback on the Premier related to the metrics. With the Omicron, that's what we have seen, the decoupling of the cases with the hospitalization and also the death, where in the province, as Premier has indicated, that we don't have much of the hospitalization because of COVID. And the majority is about where it becomes incidental, where a person will have gone to the hospital for something else and then they get tested. Hence, we find that even our metrics that we use in regard to where we are in terms of the pandemic, severity and all of those, you see Dr. Cloete will do the presentation that talks about the risk of the severe admission. It's not only about the hospitalization, but in the use of the steroids, the use of the ICU, and also the use of the ventilator. And taking note that we are coming from 3 weeks where we have had, each and every week we had holidays, like the 16th of December, the Christmas, and the New Year. Therefore, you might find that there are not many people who are coming to test, because some of them, they are still busy or they are elsewhere. So therefore, that's why you might find also with the deaths, where, because must be surprised when you see we have got a high number of the death on a particular day. It's a death that have been counted retrospectively, and also some of them, it's one when we have to reconcile with the excess death that are coming from the MRC in relation to the data that they collect, was the death that will have happened outside the health system. So you need to understand, but it's still the average is still about 2 to 3 deaths, and sometimes you get to the 0 around that. Where we are now in regard to the boosters, we started the boosters for J&J on the 24th, and the 28th is about the Pfizer, again for the whole of the vaccination for the whole country. We find that people still have not only have vaccine fatigue, now you add that layer because we are still on holidays. So that's why when we open, which is already open, when people come back, there's many, we still have to target these different populations, and also in regard to the geography. We want to appreciate the districts like Overberg, we'll find that there has got a high number of the people that are vaccinated, specifically the over 60s. And when you zoom in the over back exactly where, you'll see the over strand has got the highest numbers of those. So we appreciate that. And we've seen also some of the increase of the even vaccination around the winelands. But we still have got older persons. For me, it's about older persons. As you know now, even the children get vaccinated. But older persons, because we don't know what could be the next variant. Like recently, we hear about new variants in France and the new variants elsewhere. So there'll still be such. Therefore, that's why I appeal to the people to vaccinate and also to have the boosters, which is having said that January and Feb, for example, that's when the students are coming, universities are opening, there'll be a whole lot of the young people who'll be flooding in. So that's why I want to piggyback, working with the universities, with the community colleges, with the TVET colleges, how do we come up with a package, especially targeting the first years where we have the vaccine, and also we could be able to encourage other health services like the HIV/AIDS as part of what the universities normally do. We are not forgetting about other illnesses. The trauma cases that we have seen during this period, we appeal to the people not only to prevent COVID through the wearing of the mask, because we still have to wear the mask, keeping the distance and avoiding the gatherings and also poorly ventilated areas. But also in regard to the trauma, especially with the car accidents, motor vehicle accident, people to drive carefully because have absorbed every social ill, every anything mishap that is happening outside there, it does come back to health. And then lastly, with the recall of the policy coming from the national in regard to the contact tracing, isolation, the quarantine, we haven't received yet the feedback in regard to that aspect. I think it talks to what the Premier is saying, that one of the stumbling blocks about that is because it doesn't talk to the regulations in terms of the DNA, Disaster Management Act. As we know that the National Health Act does make a provision for the medical notifiable conditions. So I believe that as health, now we could be able to tackle ourselves, but and see how we can be able to make use of other parts that are in terms of the regulations. For example, on the adverse effects events, in terms of the committee that's already been established at the national level, just in case of some of the effects related to the vaccines, so that you don't have to do it in each and every province. But generally, the notifiable medical conditions regulations could be able to, in terms of the health, we do it ourselves. And also it will avoid the situation when we hear other people outside the health, they'll say, based on science, but all to find that based on science on what, when you say open for 1,000, open for 250, you can gather about 7,000 on what basis. So they're not necessarily talking to about us or to us, but they're talking about for their own. For us, it is about the gatherings, the poor ventilation. It is crucial. So thank you very much, Kayla, for this opportunity. We are looking forward to work and also to go to as far as all other districts, putting together the COVID response, plus also other illnesses. I think in the 3 weeks' time, I'm going to the garden route, where we'll be looking in terms of the demand creations in most of the other parts of the province, where there's still a lower level of the uptake. Thank you.
Thank you very much, Minister. So we'll now move on to the presentation portion of our weekly Digicon, and I'll hand over to Dr. Cloete.
Thank you very much, Kayla. Thank you to the Premier and to Minister Mbombo. Kayla, can you see the slides?
Yes, that's perfect. Thank you.
So thank you. So my job today is to give an update on the COVID surveillance. Secondly, also our fourth wave response. Then the vaccine implementation update, and leaving with a few key messages. So just on the COVID surveillance update, to start off with our consolidated picture, you can see a picture to the right, which is our fourth wave picture. The grey bars now showing a plateau and a decline, actually. The active cases, which is the black line, being very high and now coming down, also very sharply. Hospitalization, which is the blue line, started to say a stabilization and actually also early signs of a decrease. The green line, which is the oxygen use, which has been a marginal increase, but not nearly as high as in the previous waves. And then I'll go in a little bit more detail today around the red lines. The dotted red line is the excess death report from the MRC, which we report against. And then the red line is our deaths reported in our system. I'll go a little bit into the technical detail of the death reconciliation. So just the national trend. You can see a very steep decline in Gauteng. There's smaller declines in other provinces. Gauteng has now met their end of wave threshold, but all other provinces still remain in the fourth wave. If you look at our own province, we are starting to see decreases in the number of daily cases, an average of about just over 2,000 new diagnoses per day over the last 7 days. This decrease may be due to recent public holidays, which could have affected testing. But the big one here is the proportion positive has decreased to an average of about 52%. And that normally, when it comes of a high of 60%, is an indication that we are probably starting to see a true decline in cases. New admissions appear to have plateaued at about 225 admissions per day. Deaths have been increasing since mid-December with large percentage increases, but low numbers. So currently we're on about 29 deaths per day. I'll come back to that. It's about a 47% increase week on week, but that's also been due to some death reporting correction in our system. So we will reach officially the end of wave once we hit about 600 new cases on average on a 7-day moving average. So if we look at the metro resurgence, you can see in most places in the metro, there's been a decline virtually in all sub-districts. If you look at the rural, there's been a big decline in Cape Winelands. The others are still plateauing, so it's a little bit behind the metro. If you then go to our reproduction number, which is normally looking at whether we are having more cases or less cases, you can see it's firmly below 1, and that is also been now, and therefore the decline of cases are noticeable. The short-term prediction from the South African COVID Modeling Consortium, if you take the solid the solid black line, that is what happened just before Christmas. You can see we peaked at about 4,500 cases per day. It came down quite rapidly. That's why we're at about 2,200 now. So you can see that dark line coming down very sharply. The prediction for this coming week is that we will go down to about 738 towards beginning of next week, and then 640 the week after. So it is actually, a prediction is quite a steep decline, and you can see the dotted lines is we're starting to move very close towards that prediction. So if you look at Omicron still, no big difference. All the cases literally that's been done in sequencing in the Western Cape are all due to Omicron. If you look at the comparison of the number of cases with previous waves, you will see the red line is the fourth wave, and you can now see for the province as a whole that it has peaked and it's coming down. And you can also see it was initially very high in private and in much higher in private than in public, and it's both coming down. And to the right, we're showing you specific geographic areas. So you can see Western in the metro was much higher than the previous waves, but Mitchell's Plain and Khayelitsha very similar to the first wave, and it has also been showing a decline. So just to give you a little bit more explanation about the technical aspect of today's presentation, just to explain a little bit where our clinical event reporting comes from. So this, many people that have gone onto our onto our dashboard, daily dashboard, have had queries about this. So just to explain, where do we get our daily report from cases from? So we get it from private labs, we get it from the NHLS, and we also look at the NICD line list. And in a sense, if a case is known to us, we draw from all of those places, then we don't add and duplicate the case. We only take what is not known to our system and import it into our system. But because we do that, there might be times when we're out of sync with the NICD list, because we do then what is called a cleaning exercise by taking out duplicates and things like that. So we receive our data directly from laboratories, consolidated data from NICD, and there's normally some differences because of the deduplication between ourselves and NICD. If we look at admissions, our COVID cases in the public hospital admissions and then private admissions, we get from a system which is called DADCOV. It's a national system. So we have our own hospital system, which is Clinicom, but we draw the private sector admissions from DADCOV. And these admissions are determined by diagnosis within 21 days of admission date. So also what you would have picked up, Minister Mbombo said, in the last wave, a lot of these admissions are now incidental admissions because people are coming to hospital for other things, and there happens to be a positive test within 21 days of the admission, and they could be coming for completely other things in terms of the why they're in hospital. Then for today, just to kind of explain a little bit about deaths, we also get deaths from public hospital deaths. We also get it from the COVID cases. We link it with COVID cases. Then we also have it from the DADCOV system. But then, as Minister Mbombo said, we also get it from the population registered deaths, which the MRC uses from Home Affairs. So again, when we go through all of these systems, we look with the ID whether a death is already in our system, and we try and get duplication out. So we only look at the residual deaths that's already not recorded in our system, and then it's added weekly into the system. So these things, again, deaths also now within 28 days of diagnosis or within 14 days of a discharge following a COVID admission, we are now starting to see in our own death data that there are people that also has an incidental COVID diagnosis for death because they died of other causes, not necessarily primarily because of COVID. So we are currently doing a once-off update of this data. So there's been some administrative and technical delays for our own public sector inpatient deaths, which we've updated over the last 14 days. We've cleaned it all up to see that we got all the deaths in the system. We've also, this population register has now had a 2-week delay. Our normal pattern is to do it weekly. Now, because of the 2-week delay and the various public holidays, we now have a big number of deaths that we have to import into the system. And therefore, today, there's a large number of deaths that will be reported. It's in excess of 150 deaths. It doesn't mean that these 150 deaths happened in the Western Cape overnight. These are all distributed by date of death over the preceding weeks. And the pattern which we have is very similar and consistent with prior reports. So you see a big blip of reported deaths, but it is actually just an update of bringing a lot of data from different sources together after the Christmas and holiday period. So what does that take us to? It takes us to these comparative data. So on the top, you can see cases. Now, cases on the 23rd of December, we had 3,600 active cases on a 7-day moving average. That was the highest we recorded. And you can see that's higher than each of the peaks of the 3 previous waves. If you go to the left bottom, you'll see the smear positivity on the 22nd of December was 63%. It's now down to 50%. So we're starting to see a decline. Admissions is what we've been showing to you. And it says there that we currently have 230 admissions per day. That compares to 362 admissions in August and 478 in January for the 3rd and 2nd wave, respectively. And then deaths, as I just given you an indication, you can see that even with the 29 deaths per day now, over the last couple of days, it is significantly lower than what we had in the 3rd wave, which was 123 deaths a day, and in the 2nd wave, which was 146 deaths a day. So we have now to reach the end of wave, which we think we are heading towards. When we get to the 600 cases a day, we will now obviously be moving out of the 4th wave. So this is the MRC excess death report, and this is a very sensitive comparison. So you can see now for natural causes, deaths from natural causes, that's in excess of what you expect for this time of the year. Is above the threshold for national, and in the Western Cape, it's above the predicted bounds for the last 2 weeks. So are we seeing few admissions and deaths? And this is then the most important slide for all of us. This is now with all that death data imported and corrected. So you can see that the widening gap between cases, admissions, and deaths. Just to explain to everybody, the cases are in blue, the admissions are in red, and the admissions are in green. And what we've done is we've brought the deaths down in red. Now, to make it comparable, we've made it 3 times. So you'll see the red figure is bringing the deaths up 3 times just to show the effect. But in the dotted line at the bottom, you can see that's the real number for deaths. So the dotted line is actually there. So if you go to the far right, you can now see that between the number of cases and hospitalizations, there's a big gap. And then between the number of hospitalizations and deaths, there's a big gap. So new admissions currently is about 64% of our third wave peak admissions, and deaths are at 24% of our third wave peak. So immunity from undiagnosed prior infection, known prior infection, and also from immunizations has given us protection against severe disease. There's also now data that suggests that Omicron may be less severe than Delta. But even if you take protection from vaccination and prior infection, the reduction in severity is unclear. And even that might be quite similar to the ancestral strains of COVID prior to Delta. And just the one last point of these deaths is that what we are seeing here then, with both deaths and also with cases, is this incidental COVID positive deaths that goes with it. So it is not really all of those deaths or all of those admissions are due to severe conditions of COVID, which are related to being in an ICU, using oxygen, and being on a ventilator. And I will show the oxygen use later that bears this out. So then just to come to our data around a proportion vaccinated people. So last week we did show the overall figure. Now we can break it down into age groups. So what this data shows here is that in the age group 18 to 34, on the 7th of December, 31% of people in that age group were fully vaccinated. But of all the cases that we've now had during this period, only 12.4% of people in that age group that had cases were fully vaccinated. So you can see, if you go to 35 to 49, 47.3% of people fully vaccinated 7th December, but the number of cases in fully vaccinated people was only 22%. The same in 50 to 59, 56.7% fully vaccinated, only 22% of cases, people were fully vaccinated. And then the last one, the one that we're most concerned about in terms of protection, is over 60. 65.9% of people were fully vaccinated on 7th December, but only 21.6% of cases was in that group. So the raw data now suggests that vaccination, even though there were lots of cases, even vaccination protected against getting infection for people. And it's partial protection, it's not full protection, but we always knew it's partial protection, but there is proof, therefore, even for Omicron, there were partial protection of getting the cases. More importantly was to look at the deaths per age group. So we've taken this same period, 15 November to 11th of December, and in that time, we looked at all the deaths, and you will see in the different age groups. Before example, 18 to 34-year-old, there were 4 deaths. Everybody in that group, all 4 deaths, were not fully vaccinated. So there was nobody that was fully vaccinated that died in that group. 35 to 49, 11 deaths. 1 person was fully vaccinated, but the other 10 were not fully vaccinated. If you take the 50 to 59, 8 deaths, only 1 fully vaccinated, 7 were not fully vaccinated. And then the important group, 60 plus, there were 32 deaths. 3 were fully vaccinated, but 29 of them were not fully vaccinated. Again, it's showing the protection of vaccination, even bigger protection for severe disease and people dying from COVID. And then we've also broken this down now in terms of those deaths. Just to caution that the deaths here are small numbers. So you will see that this is, again, the number, how many people in the population, this is over the age of 18, the full group. How many people had cases from fully vaccinated, and then how many of the deaths. So you can see from Metro all the way through to West Coast. I'm very keen to see what happens in Overberg, because Overberg, you can see 53% of the people were fully vaccinated. 16% of the people that got cases were vaccinated. 0% of the cases that died were fully vaccinated. In Garden Route, 14% might look big, but it is actually 1 death out of 7. So it really just shows you that the small numbers can give a big percentage increase, but it is a single death. If we look then at the protection, and this is what the data is now showing us, that amongst COVID cases, full vaccination versus no vaccination provides similar strong protection in the Omicron period, which is the dark green, compared with the earlier period, the light green, which was, in a sense, the Delta period, against severe COVID outcomes. So you can see there's a 3.8 times lower risk of death from Omicron if you were fully vaccinated. And there was a 3.3% times lower risk of having a severe admission or death if you were fully vaccinated. And then admission, there was a 2.7 times lower risk from being admitted if you were fully vaccinated. So this is really unambiguous data from our own sources to show the effectiveness of vaccination against Omicron. So what is the summary around all of this? So the clear evidence that reinfections occur. So we saw reinfections occur, but there is still partial protection from full vaccination. The proportion of cases with severe disease has been much lower. It's still mainly due to younger people being infected and being at lower risk for severe disease, but also this very strong protection against severe disease from prior infection and from vaccination. So there's growing evidence that Omicron may cause slightly less severe disease from Delta. But while the severe disease is smaller, the proportion is smaller, as most people have some protection from vaccination or prior infection or both, we still do get cases for people that are not protected of severe disease. So we should not kid ourselves that there is no severe disease. There is still cases. It is just much smaller numbers. To date, vaccine therefore appears to be provide strong protection now against severe disease, but also partial protection against getting Omicron, and it therefore remains still our best defense. We will continue to obviously watch the emerging evidence closely as it starts to emerge. So that takes us to the fourth wave. We've always had this, what we call an agile titrated response with multiple actions in response to predetermined triggers as we enter the fourth wave. And the idea was, if we trigger a metric, we go to a next level. If we trigger that, we go to the next level. We trigger that, we go to a next level. And our platform currently, the metro hospitals are currently running at 83% full, George 64, Paarl 67, and Worcester 76. Very important for us, the critical care occupancy for designated COVID beds at its maximum now is only about 50% full. COVID and PUI cases together makes up only 17% of all the available acute capacity across the public health system in the province. And our intermediate care facilities, places like Brackengate, currently only has 131 patients. It had 150 patients early in the week, and now we are discharging patients quicker than we are admitting. So we are truly on the decline even for admissions in places like that. Mitchells Plain Hospital of Hope, only 37 patients. We've only had to activate one ward of a potential of 4 additional wards. Saunstraal at 15, Frisian Ward 19. We didn't have to even commission that because we had no patients. And Harry in George, we didn't have to commission that facility either. The Metro Mass Fatality Center was closed before the fourth wave. And because of the low number of deaths, there's been no impact that was anywhere close to exceeding existing capacity. This is our daily dashboard that just repeats and shows the data that I've just reflected on. And then the slide that probably gives us the greatest hope for this week is now that our week-on-week increases in hospitalization has dropped below 20%, a very positive sign. So it is a turning point, because if you look comparatively in July, August, when we hit the same spot, it went down relatively slowly in the third wave, but you can see to the right-hand side, we went below 20% and it's going very quickly. So we expect the hospitalization over the next 7 days to 10 days to drop sharply from a COVID perspective. If you then go to our, let's call it the heat map for admissions, it has held true that throughout the fourth wave, we've seen people in all age groups, but the predominance we saw previously of the older age groups have virtually been replaced by a predominance of younger age group in this. And it's a combination of two things. There was less maybe vaccination in the younger age group, but also because there's higher vaccination in the older age group, there's a greater protection for the old age group landing up in hospital. So this is also a good sign for us. This is very good data for us, is that the total daily bulk oxygen for the province is currently running at about 29 tons per day. The total is divided for the public sector, which is 17 tons, and 12 tons for the private sector. Based on our public sector use, we're currently at 39.7% increase in oxygen use relative to our pre-COVID baseline. So we're still very largely below the 50% increase we needed for our first wave trigger, our first warning system trigger. So if we compare this to the third wave, on the 8th of August, the public sector was using 49 tons per day, or a 402% increase relative to their pre-COVID baseline at that point. So this decreased need of oxygen, despite this high case burden, is obviously very reassuring, and it also affirms that most of the admissions, therefore, are incidental admissions and not admissions due to severe COVID disease. And this is our trigger system, therefore, in the first warning, we didn't have to trigger it because we're still sitting at 39.7% of oxygen. So we never even got out of the first trigger line into the second or third or fourth. Just to update everybody also on our trauma, because we're keeping an eye on this. So over the last 3 months, we've seen 35,000 trauma cases at our 20 emergency centers. Obviously, the recent lift of curfew around the 30th of December, we expected an impact on it. On New Year's Eve, there was an increase, but it was comparable to what happened over the Christmas weekend. So if you take the last 3 weeks, you can see from the week of the 16th of December to the weekend where Christmas and Boxing Day together was on 25th and 26th, and then the weekend with New Year's Eve. So on absolute numbers, the New Year's Eve weekend is the highest with 708 patients compared to 687 on Boxing Day. But the 2nd of January, which was a Sunday, it dropped down to 462. So the experience on the platform was that people experienced the New Year's weekend lighter than the Christmas weekend because of the 2 public holidays the previous weekend and the busyness on both Boxing Day and Christmas. If you look at admissions during that period of time, you can then see that also our admissions was roughly increasing across all of those, but the weekend admissions, which is 51 on New Year's Day, is also relatively high compared to Boxing Day and Christmas, with both days being quite high in terms of that. So our healthcare workers, we're also glad to see this trend. It peaked in the week of the 12th of December, 12th to 19th of December, that we had more than 1,000 infections in healthcare workers. That impacted on our ability just before Christmas to maintain all our healthcare services. But luckily, 19 to 26, it's dropped. And now from 26 to the 2nd, it is dropped even further. So 1,141 active cases. And the impact that has had is that about 1,300 staff members are in isolation. And of the clinical staff, 995 of that was doctors, nurses, and other categories. So we still had some problems with delivering healthcare services, but a lot of staff are now returning back to duty as they come out of isolation. So we expect this situation to improve this week and into next week. And we're still awaiting that the revised National Department of Health Quarantine and Isolation guidelines so that we can stabilize the situation going forward. So the vaccine implementation update for today, up until yesterday, 46.6% of the population over 18 in the Western Cape were fully vaccinated. That's compared to 39.4% for the country. In the preceding week, last week, we had 24,000. So there's been a considerable drop week on week of vaccination uptake in the province. Our total to date is 4.4 million vaccinations. And the vaccination in the last 24 hours was only 6,300. Our registrations has slowly, incrementally increased. So we're currently up to about just short of 50% of everybody that's eligible over the age of 12 registered on the system. You can see a breakdown of that per age band. The highest registration to be expected is people over 60 at 73%. The lowest is between 12 and 17 at 19.7%. And then the breakdown in the various geographic areas. Our total vaccines administered per week, you can see a drop down to 17,000 over the last 3 days. And you can see the considerable drop down over the Christmas and New Year period as people did not present themselves.
All right, there you go, an update from the Western Cape. Dr. Keith Cloete there giving us the state of play in that province.